The focus has turned to the southwest of Sydney, in particular 3 local government areas, Canterbury, Bankstown, Fairfield and Liverpool. 21 cases have emerged in 3 days and exposure sites are growing, while testing remains comparatively low, prompting concerns the virus could be spreading undetected. The Premier has called on residents in the communities not to mingle with family. And Greater Sydney has been told not to be complacent. This is not just Sydney, but a significant area around it too, with lockdown extended for another week. The region under stay-at-home restrictions stretches about 200 k's from Shell Harbour in the south past Wollongong to the Central Coast in the north, including places like Gosford. For many towns, it's a case of a few kilometres which determines whether they're under lockdown. In the Central Coast region, you can see Wyong falls inside the lockdown zone, but Waihee is not. In the Blue Mountains area, Bilpin and Katoomba inside the zone, but Lithgow not. And in the south, Buxton, Bargo and Dunmore are under stay-at-home orders and Kiama is not. So millions of people affected by this. They've been under 2 weeks of lockdown already, extended for another week. Going to be closely watching those numbers over this coming week. Reporter Lara Hyams joins us now from Bankstown in Sydney's west. So Lara, what's a particular concern with these 3 local government areas in Sydney's west and southwest?
Well, essentially, Joe, it's the dynamics of the demographics here. So these 3 local government areas are all in the southwest pocket. So Canterbury, Bankstown, Fairfield and Liverpool. These were areas that were earmarked specifically by the New South Wales Premier yesterday and also by health officials. A raft of suburbs were mentioned in that as areas for concern. We know that health officials haven't quite ruled out that there could be further restrictions imposed on these particular areas. We could be seeing something as what the Northern Beaches cluster had. We're still not sure exactly what those further restrictions could be. Now, this is all in the wake of 21 COVID cases across these particular local government areas in the last few days. We know that with the demographic here, it's very multicultural. There are large families here. And the reason why that is important is because the New South Wales government is wanting to enlist the help of community leaders and religious leaders to help spread the message that mobility needs to be reduced. And that is a way as well to overcome any language barrier that may be hindering the expression of that message.
Yeah, we just had one friendly local there giving us a wave behind you, Lara. And so take us through the figures more broadly.
So yesterday we saw a total of 27 cases which were recorded. We know that there were 18 of those which were linked to existing cases, so existing outbreaks, 9 which were under investigation. Now, of that, we know that 13 of those individuals were in isolation at the time that they were infectious. 7 were infectious or in isolation for part of the time that they were infectious, and 7 were out in the community of that time. So the numbers aren't great. We do know that there has been a slight increase in the testing regime. 45,000 tests were conducted yesterday. But it's not only the New South Wales jurisdiction which has been worried about those figures. New Zealand has also continued its pause of the travel bubble between New South Wales and Queensland. They particularly want the figures of not only COVID to be reduced, but also those cases under investigation. So that all plays into that criteria to have that bubble reopened again. They've also outlined their plan for repatriation for New Zealand residents. They will be required to return a negative test 3 days before they enter the country too. So there'll be all eyes coming on New South Wales for the figures going ahead.
And Lara, with this lockdown over the last couple of weeks, there's been some questions about just how extensive the lockdown is. One of the questions to the Premier yesterday was a luxury handbag shop, for example, was open in Bondi Junction. What are you noticing there around the Bankstown area this morning in terms of places that are still open through the lockdown? Is it still really limited, the number of places open there?
Well, Well, around this particular strip, I've had a couple of locals come up to me, as what you would have seen in the background. They're a very friendly lot here, and a lot of the business owners have been saying that it's pretty quiet normally. We've got the train station nearby. There's just not the patronage that are going through there.
Right.
A lot of them worried about the bottom line going ahead. But I tell you what, Joe, the food options have been pretty good. I've managed to get a banh mi for only $4.50.
Good stuff. But places like, does it appear that it's only kind of takeaway food and supermarkets that are open, or have you noticed any other kind of shops open around there?
No, it's pretty limited, Joe. A lot of the business areas, I've seen lawyers down there, I've seen real estate agents, all have got the shutters down at the moment. So it's not quite vibrant in terms of a business perspective, just the takeaway stores, which are really hoping that they can get a few more patrons throughout the day.
Yep. Okay, Lara Hyams reporting there from Bankstown in Sydney's west. So there are millions of people affected by this lockdown going into a third week. Some businesses that relied heavily on the school holiday trade are really struggling, and there are casual workers who are losing pay while still having to get by in an expensive city. There's talk of some extra support for businesses. That's not clear yet. It can be confusing for people to know where to go and what they can get. So we've got reporter Alison Shao to look into that for you. Alison, g'day. So what are the details on which businesses are eligible for support now, and what can they get?
Hi, Joe. Well, the New South Wales government will spend $1.4 billion trying to help these struggling businesses who are really suffering during this COVID-19 lockdown. And many businesses say that they're struggling to survive. They'll be eligible to apply for grants, support payments from the state government from July 19 on the Service New South Wales website if they've been affected by this lockdown. But there's some eligibility criteria that they'll have to meet in order to apply. So if you're a business in New South Wales, anywhere in the state, not just in directly the Greater Sydney lockdown, you could be eligible for grants of up to $10,000 if you've got a turnover of more than $75,000. What you'll have to do is you'll have to prove that your loss of turnover in this period of lockdown is a certain amount compared to the same time in 2019. So you'll be eligible for $5,000 if you saw a decline of 30% of turnover. You'll be eligible for $7,000 in payment if you saw a decline of more than 50%, and you'll be eligible for $10,000 if you saw a decline of 70% or more. There's some more eligibility criteria for those small businesses. You'll have to have a payroll tax threshold of $1.2 million or have 20 full-time employees or less. And that's different if you're a tourism or hospitality business where you'll have to be paying your staff less than $10 million each year. Now, since the lockdown was extended yesterday officially, the state government has said that it's looking at expanding this package to help businesses with a turnover of less than $75,000. So that hasn't been officially announced, but we'll be looking to see what the official announcement is in the coming days for those businesses.
And so, just to be as practical as possible, if there is a business owner watching now and they're keen on getting that support or looking into if they can get that support, where do they go?
So they'll need to go to the Service New South Wales website, but the link to apply is not yet open. It says that it'll open in late July if you go to the Service New South Wales website, but in the press conference, the Premier said that they'll be available from July 19. There were some additional measures that the government also announced last week to help people, including expanding the Dine and Discover program, extending that expiry date till August the 31st. It was initially going to expire on June the 30th, and people can now use those vouchers on takeaway services, whereas they were initially only applicable for dine-in services. They've also announced that they'll have optional payroll deferrals for all employees and also optional deferrals of gaming machine taxes for those hotel businesses.
Okay, let's get on to individuals now, because there's deep concern about what's happening for casuals through these outbreaks around the nation, and in particular in Sydney at the moment. So if there are individuals out there who've lost significant amounts in terms of their wages over the last couple of weeks, what can they do?
So the Commonwealth Government is providing support for individual workers while the state government is providing those grants to businesses. So if you're an individual and you've lost income because of this lockdown, you'll be eligible to apply to the federal government for payments of $500 a week if you've lost 20 hours of work or more in that week. And you'll be eligible for $325 a week if you've lost less than 20 hours of work. Now, there's specific criteria that you'll have to meet, and so it's part of the hotspot declaration. So you have to live in one of the council areas that is affected by the lockdown. So as opposed to the state government grants where you can live anywhere in the state, you'll have to live in the Greater Sydney area to be eligible. And it doesn't include the first 7 days of lockdown. So after the first 7 days of lockdown, if there's a period of another week of lockdown and you've lost work, then you'll be eligible for these $500 or $325 payments a week. Now, you'll also have to meet the criteria that you have less than $10,000 in liquid assets. That means that if you've got $11,000 in your bank account, you won't be eligible for these payments. And there's also restrictions on if you're receiving any other type of welfare support from either the federal or the state government, you won't be eligible for these payments. And if you're an individual who thinks that they are eligible, you can apply now on the MyGov website for those periods of lockdown. And since this lockdown was announced yesterday, the state government said that it had been in talks with the federal government to see if they could reintroduce the JobKeeper program, and the federal treasurer Josh Frydenberg said that they had denied that request. Now, we understand that talks are still ongoing, discussions between the state and federal governments to see what more support can be provided. The treasurer says that he wants to look at things like rent relief, more support for casual workers, and also looking at a post-lockdown recovery package for businesses.
Yeah. And Alison, yes, so just briefly, and for individuals out there who have think they might be eligible, they go to which website do they go to? Which is the best website to go to?
So they'll go to the MyGov website. That's mygov.com.au.
Good stuff. Okay, Alison Chow reporting there from Sydney. 10 staff at the Sunshine Coast University Hospital have been commended for putting their lives at risk to save the life of a COVID-positive patient. Health authorities say the patient went into anaphylactic shock. Reporter George Roberts joins us now from Brisbane. George, g'day. So how did this happen?
Well, Joe, Qd Health says that the patient was being transported from the COVID ward to another medical unit when they suffered an allergic reaction to a so-called contrast dye, which is a chemical that's used to help organs and blood vessels show up in MRIs and CT scans. The patient went into anaphylactic shock, and these 10 staff at the Sunshine Coast University Hospital sprung into action. Effectively, they didn't have enough time to don the usual protective paraphernalia that they would if they were going to deal with a COVID-19 patient, the face masks and the shields, etc. They sprung into action and they went to work on this patient and saved them from that potentially deadly anaphylactic shock. But in the process, they obviously exposed themselves to COVID-19 as this patient was a confirmed case. Now, those actions have been described by the Premier Anastasia Palaszczuk as heroic. She says what they did was absolutely astonishing. And the Chief Health Officer, Dr. Jeanette Young, has said that what they did was right. They put themselves second, they put the patient first. So they've been highly praised for what they've done in extraordinary circumstances, Joe.
And what happens to the staff now?
Well, unfortunately for their efforts, they're being rewarded with 14 days in isolation. Now they have been deemed as primary and casual contacts of a confirmed COVID-19 case. So that means that they will now have to go into isolation for 14 days, like thousands of other people who have come into contact with the known cases that we have in Queensland at the moment. So they'll have to isolate and get tested until they're cleared to come out of isolation. Joe. Now, the area of the hospital has had a deep clean, and the hospital has deemed that there has been no risk to anybody else involved.
And George, people feeling pretty optimistic there in southeast Queensland about the situation with the number of COVID cases over the last week or so?
Look, that's right, Joe. I mean, obviously just one case yesterday of local transmission, but a contact of 2 already known cases, a housemate of 2 known cases. So that was some good news in a sense, because that person was already in quarantine and was in isolation, and so they tested positive but were already quarantined. So that those low case numbers are giving authorities and the general public here reason to have their hopes buoyed. But obviously there are some restrictions still in place, with people wearing masks when they're out and about, except when exercising. People are wearing masks in the workplace as well, for example. And of course there's 1 person per 4 square metres in, cafes, restaurants and bars, and still a ban on dancing, Joe, which of course is a blow to many people. You yourself, I know, are a big fan of that when you come up to Brisbane. So still some restrictions, but certainly looking up here in Queensland, and obviously thoughts of Queenslanders are with our southern rivals in that sense.
Yep, okay, good stuff. George Roberts reporting there from Brisbane. Victoria has recorded another day of 0 coronavirus cases. That state's COVID-19 restrictions will change again from tonight, with rules easing in Greater Melbourne, bringing it into line with regional areas. From midnight, density limits relax for hospitality venues, gyms and places of worship, and crowd numbers will increase for footy games. Masks are no longer required for office and factory workers and in schools, but will still be required for most other indoor settings. Disability care workers could soon be forced to get a COVID vaccine, with National Cabinet set to consider mandating injections for the sector. The Minister responsible for the National Disability Insurance Scheme, Linda Reynolds, backs compulsory vaccinations after a similar decision was made for aged care workers. Political reporter Jane Norman joins us now from Canberra. Jane, g'day. So how's the rollout going in the disability care sector?
It's going pretty badly, Joe. We know that about 20,000 Australians live in disability care, and so far the latest figures we have are that only about 355 have been fully vaccinated. Now, when you look at the staff, it's actually a similar figure to the aged care workforce. About 35% of staff working in disability care have received at least 1 shot. But I've got to put some caveats around these figures, Joe, because unlike aged care, the government does not release regular or detailed data about the vaccination rollout in disability care. I think it's because it is so slow right now. And so these figures that we have are the latest we have, but they could also be days or weeks old. But putting that aside, disability care workers, disability care residents, we're in the top priority. We're the top priority, the highest priority group for the vaccine rollout, phase 1A. And 5 months into the rollout, they're nowhere near completing the vaccinations for that cohort. So National Cabinet's meeting again this week, and one of the items on the agenda is whether to make these vaccines mandatory for those working in disability care. You might remember just last week, National Cabinet took the decision to make the jabs compulsory in aged care from mid-September. So that decision is likely to be made tomorrow. And ahead of that, the Minister for the NDIS, Linda Reynolds, says she personally would like to see the mandating of vaccines for the disability care workforce.
This will be discussed today. I'll note that nearly 40,000 disability support workers have already been vaccinated, but I would certainly like to see it become mandatory.
And Jane, Indonesia is going through a really rough time at the moment with COVID cases and deaths. What's Australia going to do to help?
Yeah, well, Indonesia's had a massive surge in COVID cases. So in Australia right now, I've got about 500 active cases. In Indonesia, they had a daily record of 31,000 and more than 700 deaths in the latest outbreak. So Australia overnight has committed to sending Indonesia 2.5 million doses of the AstraZeneca vaccine, as well as a whole pile of medical supplies like oxygen tanks or cylinders, ventilators and testing kits. The rollout in Indonesia for the vaccine is even slower than Australia's. So these, few million AstraZeneca doses should at least help a little bit. But right at the start of the, race to obtain vaccines, Australia made a commitment to helping our regional neighbours. About 15 million doses of AstraZeneca are being sent to our Pacific neighbours. And that's because we have plentiful supplies here, Joe. The CSL facility in Melbourne is pumping out about 1 million doses a week. So we do have enough to help our neighbours in the region. And really, it's in all of our interests to get as many people vaccinated against COVID-19 as possible.
Okay, Jane Norman there in Canberra.